All right, we're back. We've got a couple more clips to get to on this debate thing. Couple of important ones, I think. Let's start with this one. Is this the? Do you have the number 4 lined up? That's the. Okay. Now, here's the thing. There is. It sort of depends on where where you're situated. I think ideologically, as to
they changed the time codes, so this might take a little bit. But go ahead.
Okay, so this sort of depends on where you may sit ideologically in terms of your assessment of the extent of the differences between Warren and Bernie, at least in the context of domestic policy, right? Even if you put aside the questions of their approach to actually their actual practical approach to change, they may come to similar destinations. They do it from different places in terms of what is what direction they're heading from. I think obviously Warren is more about reform of an existing system. Sanders, probably to less of an extent than he will be accused of, but to some extent is looking to make some structural changes that as opposed to sort of containing certain problems, he wants to change it and hopefully eliminate those problems in terms of the way that markets work and et cetera, et cetera. But nevertheless, the value of having both of them in a debate addressing major issues in which they at least on broad strokes agree, I think is invaluable. It is always better to have two people saying something than one person saying something. And so here's Elizabeth Warren, and I think she is particularly good at this. Now, Bernie Sanders has made it clear, I think, and introduced the country largely to the understanding of we're going to have to raise taxes, but the amount that we raise taxes is going to be less than the amount you are currently spending on healthcare when you include premiums, co-pays, when you include whatever it is, whatever else comes between premiums and co-pays and things that aren't covered. You're going to be paying less in taxes than you are in all those other expenses associated with getting healthcare. Elizabeth Warren, I think, has been very good in basically saying, I'm not even going to accept the premise of a question about taxes, because at the end of the day, a dollar is a dollar. And you want us to believe that tax dollars constitute $2, where every dollar paid to an insurance company is worth $1. And that's just not true. And here is that exchange from the debate last night.
Was saying there about health care. He's actually praised Bernie Sanders for being candid about his health care plan. Senator Sanders has been candid about the fact that middle-class taxes are going to go up and most of private insurance is going to be eliminated. Will you make that same admission?
So let's be clear about health care, and let's actually start where Vice President did. We all owe a huge debt to President Obama, who fundamentally transformed healthcare in America and committed this country to healthcare for every human being. And now the question is, how best can we improve on it? And I believe the best way we can do that is we make sure that everybody gets covered by health care at the lowest possible cost. How do we pay for it? We pay for it. Those at the very top, the richest individuals and the biggest corporations, are going to pay more. And middle-class families are going to pay less. That's how this is going to work.
Direct question. You said middle-class families are going to pay less, but will middle-class taxes go up to pay for the program? I know you believe that the deductibles and the premiums will go down. Will middle-class taxes go up? Will private insurance be eliminated?
Look, what families have to deal with is cost. Total cost. That's what they have to deal with. And understand, families are paying for their health care today. Families pay every time an insurance company says, sorry, you can't see that specialist. Every time an insurance company says, sorry, that doctor is out of network. Sorry, we are not covering that prescription. Families are paying every time they don't get a prescription filled because they can't pay for it. They don't have a lump checked out because they can't afford the copay. What we're talking about here is what's going to happen in families' pockets, what's going to happen in their budgets. And the answer is on Medicare for all. Costs are going to go up for wealthier individuals, and costs are going to go up for giant corporations. But for hardworking families across this country, costs are going to go down, and that's how it should work under Medicare for all in our health care system.
Senator Sanders, you were invoked by the vice president.
Now, pause it. Now, this formulation I think is good, particularly in the context of a Democratic debate, because people need to understand this dynamic, which is not as self-evident, I think, as, it is to people who are sort of really immersed in it. And I don't know if Donald Trump is going to be sharp enough on a debate stage to say, so you're going to raise taxes at that point. I feel like any other Republican would, but he may not listen enough to engage in this stuff.
He's got one of his, I just think that's one of the go-tos. Like, he'll say that probably in a completely non sequitur way on other things.
He might. So I think that the next step in this argument has to be sort of more specific in accusing, like, you are trying to hide costs behind the idea that taxes are somehow more expensive. A family doesn't care. They want to know how much money is in their bank account at the end of the month. And this is going to mean more money in their bank account. So we could raise taxes through the roof. And if everything else is, doesn't cost you anything, then they're going to be happy. And then you say, but we're not going to raise taxes through the roof. There's going to be a tax raise, but it's going to be nothing compared to the relief that you're going to get, the medical cost relief. In fact, I think on some level, coming up with a name for that probably would be helpful. Medical Cost Relief Act is, that's the way they do it. Like, tax is a burden. Well, you know what? Medical cost is a burden.
Massive Net Savings Act.
Right. Something to that effect.
Well, it goes back to, I always use this example of taking a European Union Studies class and going over Denmark. And definitely, especially as an American, the taxes that he broke down, the professor in the class, you're like, that's a lot. And then, the obvious corollary is like, but you have full college, you have full health care, you have all of these things. And I think it was a net positive, actually, in terms of what was literally flowing out of your pocket versus what was being kept in your pocket if you weren't ultra wealthy.
This is Biden's response, if we want to see that.
Right. Yeah. This is where Biden basically says, I'm going to choose the response that Republicans will give you.
The largest out-of-pocket payment you'll pay is $1,000. You'll be able to get into anyone who can't.
Pause it. Just a minute to contemplate that. The largest out-of-pocket cost you're going to pay is $1,000. That's a lot of money
For any given procedure?
Presumably, yes.
I mean, look at how out of
a lot.
Look at how that's out of touch is an overused phrase, but that's one of the more out of touch things I've ever seen.
Bragging about it. Bragging about it.
Only $1,000. Everybody can do that.
It's a banana, Michael. How much could it cost? $10?
Number one, my health care plan does significantly cut the cost of the largest out-of-pocket payment you'll pay is $1,000. You'll be able to get into anyone who can't afford it gets automatically enrolled.
Pause it.
In the Medicare.
Pause it. Anybody who can't afford it gets automatically enrolled. Okay? So you don't get automatically enrolled. In fact, not only it's, there's a number associated with what can't afford it that he may not even be aware of. It's in his plan, but it's 138% of the federal poverty level. So it's only 8 percentage points higher than what Medicaid allows for in the expansion of Medicaid. So you're really talking about between 130% and 138%. Those people get automatically enrolled in this. Continue.
Into anyone who can't afford it gets automatically enrolled in the Medicare type option we have, et cetera. But guess what? Of the 160 million people who like their health care now, they can keep it. If they don't like it, they can leave. Number one. Number two, the fact of the matter is we're in a situation where, if you notice, he hadn't answered the question. This is about candor, honesty, big ideas. Well, let's have a big idea. The tax of 2% that the senator's talking about, that raises about $3 billion. Guess what? That leaves you about $28 billion short. The senator said before it's going to cost you in your pay. There will be a deductible in your paycheck. You're going to, the middle class person, someone making 60 grand with 3 kids, they're going to end up paying $5,000 more. They're going to end up paying 4% more on their income tax. That's a reality. Now, it's not a bad idea if you like it. I don't like it.
Okay, now I want everybody to keep to the time, but you did invoke both senators. I have to get responses from them, then we will go on out.
Good.
Senator Warren, you go first.
So let's be clear. I've actually never met anybody who likes their health insurance company. I've met people who like their doctors. I've met people who like their nurses. I've met people who like their pharmacists. I've met people who like their physical therapists. What they want is access to health care. And we just need to be clear about what Medicare-for-all is all about. Instead of paying premiums into insurance companies and then having insurance companies build their profits by saying no to coverage, we're going to do this by saying everyone is covered by Medicare-for-all. Every health care provider is covered. And the only question here in terms of difference is where to send the bill.
Senator Sanders.
Let us be clear, Joe. In the United States of America, we are spending twice as much per capita on health care as the Canadians or any other major country on earth.
This is America.
Yeah, but Americans don't want to pay twice as much as other countries.
Pause it. Like what? This
No,
is
that's
America.
pure Republican pablum.
Yes.
That's all it is. That's every argument has been stripped. And what do you have left? This is America. And by the way, it's only $1,000. I mean, who couldn't afford that? Probably a lot less people after your bankruptcy bill, you prick.
It's really stunning that people find this compelling. But I don't know how many people watched last
This
night.
is America.
I don't think any normal people out there find this compelling. I think insurance companies find it compelling, and the politicians that they give money to.
Somebody is saying they're going to vote for Joe Biden at this point. I think
Oh no,
it's gonna be less.
I think a broader thing. I think very few human beings found any of last night compelling.
Right.
Yeah,
It was
people
not a
aren't-
compelling debate.
Most people who say they're going to vote for Joe Biden aren't doing it because they find him compelling. They just erroneously think that he stands the best chance of beating Trump.
I mean, I think that's true, but it gets harder and harder to make that case. It seems to me every time
I
he
got the
opens his
best
mouth.
chance of
All
beating
right,
Trump, and you want to talk about the black kids? Put Kool in the Gang on the record player.
Let's
To learn words.
Number 7. He's talking about his Medicare choice opt-in. And then Castro says, wait, what? All right, these are 2 different clips. So here's the first one is going to be Biden. And, there's 2 issues to this. One is that he doesn't seem to know his own policy. And 2 is he contradicted himself. And so it's also not a great policy. 138% of federal poverty line gets you automatically enrolled into this. But again, if you're at 130% and you're in states that have expanded Medicaid, you're in Medicaid, which is frankly better than I think his version of Medicare.
O'Rourke, and then go ahead, Mr. Vice
15
President.
seconds. Look, everybody says we want an option. The option I'm proposing is a Medicare for all, in a Medicare for choice. If you want Medicare, if you lose the job from your insurance company, from your employer, you automatically can buy into this. You don't have no pre-existing condition can stop you from buying in. You get covered, period. And if you notice, nobody's yet said how much it's going to cost the taxpayer. I hear this large savings. The president my friend from Vermont thinks that the employer is going to give you back if you negotiate his union all these years, got a cut in wages because you got insurance. They're going to give back that money to the employee?
Matter of fact, they will.
Well, let me tell you something. For a socialist, you got a lot more confidence in corporate America than I do.
Well, first off, be clear. At least part of that savings that they're going to get for not providing health care is going to go in taxes to providing health care in a more efficient system that's going to cover everybody and provide more opportunities. To the extent that there is any, and it's not like, I mean, look, this is pretty clear, right? Like these are all numbers that are pretty transparent. We know exactly how much corporate America spends on healthcare because they tell us all the time and complain about it. And we're going to know how much they're getting taxed, and we're going to know the difference. And the point is that they're going to have to entice their workers in something. And everybody's going to know what the standards are there in terms of, negotiating power, particularly in the context of unions. You're going to see a lot more power from unions in that instance. Their biggest beef with this stuff is that they're offering more quality health care, and they're going to have to find other things that make people want to unionize at that point. But
a lot of
also,
unions would be really upset with expanding the territory they could fight on.
Also, what the hell is an automatic buy-in? Like, if you have to buy into it, is it then not automatic?
Yeah, I don't know if he was wrong about buy-in.
You can
or just
automatically buy a BMW.
Like, do they take the money directly out of your bank account?
I don't know. It's
weird
hard to know
formulas.
how much of him he's just getting extra words in his sentences, or he's actually referring to something. But go ahead.
Senator Booker, you will get a minute.
Thank you. And, I also want to recognize the work that Bernie has done on this. And, of course, we owe a debt of gratitude to President Barack Obama. Of course, I also work for President Obama, Vice President Biden. And I know that the problem with your plan is that it leaves 10 million people uncovered. Now, on the last debate stage in Detroit, you said that wasn't true. When Senator Harris brought that up, there was a fact check of that, and they said that was true. I grew up with a grandmother who had type 2 diabetes, and I watched her condition get worse and worse. But that whole time, she had Medicare. I want every single American family to have a strong Medicare plan available. If they choose to hold on to strong, solid private health insurance, I believe they should be able to do that. But the difference between what I support and what you support, Vice President Biden, is that you require them to opt in. And I would not require them to opt in. They would automatically be enrolled. They wouldn't have to buy in. That's a big difference because Barack Obama's vision was not to leave 10 million people uncovered. He wanted every single person in this country covered. My plan would do that. Your plan would not.
They do not have to buy in. They do not have to buy in.
Pause it. Now, we just said that he said that. And so Castro is like, wait, what? You just said it. You admitted it yourself. In addition to it had already been fact checked last time around. So go back just a little bit. And this is the exchange now that they have somehow managed to turn against Castro.
And I would not require them to opt in. They would automatically be enrolled. They wouldn't have to buy in. That's a big difference because Barack Obama's vision was not to leave 10 million people uncovered. He wanted every single person in this country covered. My plan would do that. Your plan would not.
They do not have to buy in. They do not have to buy in.
You just said that. You just said that 2 minutes ago. You just said 2 minutes ago that they would have to buy in. You said they would have to buy in.
Have to buy in. If she qualifies for Medicaid,
are you forgetting what you said 2 minutes ago?
Be in for it.
Are you forgetting already what you said just 2 minutes ago? I mean, I can't believe that you said 2 minutes ago that they had to buy in, and now you're saying they don't have to buy. You're forgetting that.
I said anyone like your grandmother who has no money.
We need a healthcare system
you're automatically
that automatically enrolls people regardless of whether they choose to opt in or not. If you lose your job, for instance, his healthcare plan would not automatically enroll you. You would have to opt in. My healthcare plan would. That's a big difference. I'm fulfilling the legacy of Barack Obama, and you're not.
I'll be surprised to him.
There you go. I mean, really, the bottom line is also is sort of like your circumstance rather than your poverty level will dictate. Your absence of health insurance will get you health insurance, even under that Medicare for America plan, which doesn't go as far as obviously as Bernie's and to some extent Warren's, basically covers you if you don't have health insurance, as opposed to it covers you if you don't have health insurance and you're living 138% below the poverty level. So that's the big difference there. This stuff is gonna, I don't know how much of a difference that makes to people who are watching this stuff. Broadly speaking, I mean, I think there are some people who are engaged, but what it does sort of resonate was like, here's a guy who doesn't quite know what his plan is, or he's trying to be a little bit obtuse about it, and he can't communicate amongst friendly people.
Yeah, the affect of that looked horrible, regardless of the substance.
Horrible.
Yeah.
And of course, like I say, there was a lot of folks coming out. ABC had some random dude saying, like, I spoke to some other anonymous people who were like, Julian Castro really went too far
Just
with
being
that.
mean. Well, actually,
Jesus Christ.
Klobuchar specifically attacked him.
Yeah.
She's like, I would never go at somebody like that unless they were a staff member.
Right, exactly.
Never do anything like that. That's the vice president of the United States. That's not some schmuck that you can blackball from a job.
Reminder. People are going to be going up against Donald Trump and the Republicans. It's going to be much worse. Much.
Yeah, that's
much
incredible.
worse.
Watching these idiots like Buttigieg being like, "This is what people are sick of." Oh, really, Pete? This is what they're sick of.
That was another good
All
part
right,
of
Pete.
Castro.
Let's see what they're sick of.
Is Castro saying this is an election?
That
or
was the
campaign.
best. You know what? Because I really, I don't like Julian Castro because of his policy record, and I've always found it. Previously rhetorically, he was pure discount brand Obama, but I mean, between the hits on Biden and him saying that point that like we're sort of supposed to be up here differentiating ourselves, credit where credit's due.
This is not beanbag.
That is what Julian Castro said last night.
And lastly, Biden's $1,000, is the most you'll have to pay as a copay or deductible. We have like many versions of this statistics. People can't get raised $500 in an emergency. Some 50% can't raise $400, maybe 60 some odd percent can't raise $500 in an emergency.
No, they can't raise $500. They can raise $1,000 though.
Right. By going out and taking like a payday loan or something to that effect, and then getting into a spiral of debt.